Good morning, class. Today we are going to begin our discussion on stroke, or cerebral vascular accidents. Stroke is the fifth leading cause of death in the United States and is responsible for an average of 129,000 deaths per year. That means one death every 4 minutes is related to stroke. Heart disease is the leading cause of death in America, with over 614,000 average deaths every year. Cancer is number two with an average of 591,000 deaths per year. Respiratory disease of the lower airways, such as COPD and emphysema, is third leading cause of death in the United States and accounts for 147,000 average deaths per year, followed by accidental deaths at number four with an average of 136,000 deaths per year. Stroke, up until a few years ago, was actually the fourth leading cause of death in the United States, but with education and medical advances, we have been able to lower that number. Remember, with stroke, time is brain. Every minute that blood flow is reduced or blocked from any part of the brain, 2 million brain cells or neurons are lost. With ischemic type strokes, there is a 3-hour window from symptom onset where clot busting medications can be administered. This medication, known as TPA, can bust or break up blood clots, blocking blood flow in the brain. When the medication is administered in this 3-hour time window, the patient's outcome can be improved, recovery time can be reduced, and long-term disability lessened. So, what is stroke? Stroke is a brain attack where blood flow is either reduced or blocked from certain areas of the brain. This can be from a blood clot or plaque formation in the cerebral arteries or from a leaking vessel or aneurysm in the brain. 87% of all strokes are considered ischemic strokes, or a stroke that is the result from a clot or plaque formation. They can be transient or not lasting more than a few minutes, or it can be more long-term or permanent type of stroke. If the stroke symptoms resolve on their own or the symptoms only last a few minutes, they are known as a TIA, or transient ischemic attack. TIAs can be precursors for a much larger and much more devastating stroke. All strokes are considered medical emergencies and need immediate medical treatment. Hemorrhagic strokes account for approximately 13% of all strokes and can be much more lethal. These types of strokes can have an initial thunderclap headache at onset and can be extremely painful. Someone who is having a hemorrhagic stroke may have a rapid decline in neurologic status. These types of strokes cannot receive TPA and need immediate surgical intervention for any recovery. Of all the people that were hospitalized for stroke, 34% of those were under age of 65. This is a disease that can affect peoples of any age. Stroke has affected those as young as 2 years old. So, what are the warning signs for stroke? The acronym FAST helps us to determine if someone is having a stroke with 4 simple steps. F is for facial droop. Ask the person to smile. Does one side of the face droop? A is for arms. Ask the person to raise both arms. Does one arm drift downward? S is for speech. Ask the person to repeat a simple phrase. Is their speech slurred or strange? T is for time. If you observe any of these signs, remember, call 911 immediately. Remember, time is brain. 80% of strokes are preventable. Remember that TIAs or mini strokes can be the precursor to a major event. Talk to your healthcare provider if you think you are or may have had a mini stroke. Seek medical attention immediately with any signs or symptoms of stroke. A TIA can mean a major event is minutes from happening or days. It cannot be known for certain, but getting immediate medical attention is the best treatment for any symptoms of stroke, whether it lasts only a few minutes or not. Heart disease, atrial fibrillation, and diabetes are major risk factors in stroke. All three of these are treatable conditions that can modify and reduce your risk factors for having a stroke. Smoking is the number one modifiable risk factor to prevent stroke, heart disease, and many other health-related problems. If you haven't started smoking, don't begin smoking. If you currently smoke, quit. Smoking is a major health risk. The sooner you quit, the sooner your risk factors will start to reduce. Other modifiable risk factors are getting blood pressure and cholesterol under control, along with increasing your exercise. Reducing risk factor for stroke means a lifestyle change. It has to be something you are willing to commit to. Stroke is the leading cause of disability in the United States. With increasing awareness and education, the prevalence of stroke is reducing, which means the amount of recurrent disability and the overall number of deaths associated with stroke are declining too. As future nurses, we need to make sure we are promoting a healthy lifestyle for our patients and those that we care for.